All right, guys. So today we're going to talk about chapter 13 in your book, and it is a pretty in-depth chapter about the use of medications with older adults. I'm going to give you guys kind of like a brief overview of what we do a lot with medication management and some things that you need to be familiar with for your exam and for practice. Um, let's go. So, older adults consume the majority of prescriptions in the United States. And I think that that would be, common sense for most people. More than 54% of older adults take at least four prescription medications every day. And that could be scattered throughout the day. And um, when you see the abbreviation OTC, that means over the counter. So, when over the counter medications are included, sometimes it exceeds over 10 or more medications that they're taking in a day. And that can include things like supplements and vitamins and stuff like that on top of all of that medication. So, just simple things like maybe even like a pain relief cream, or that all is included in their medication list. So, when even in like a home health setting, you're going to be looking a little bit more at what medications that a client is on, because a lot of people don't know, but codas are in there. Every person that comes into the house for home health is updating medication records and asking you, do you have any medication changes? Even if it's like upping a dose or downing a dose or whatever it is, you have to change that in the client's chart, and then you need to report that back to your OT, put it in your documentation, because that stuff has to be recorded all the way throughout through their care. So there's a couple terms that we're going to be talking about throughout this chapter. One of them is polypharmacy, and that's just the use of medication, multiple medications at one time on a single individual. Um, but there's some things that need to be thought about with polypharmacy. One of the biggest is, does individual drugs have a an impact on each other? So that could be a decreasing the effectiveness of one drug versus another. So say they take a blood pressure medication and then they take a pain pill or something like that. There might be a drug interaction where it decreases the effect of one of the other drugs. So that's a huge issue, and you have to kind of be aware of that. Now, most home health companies, they actually have what's called a drug-to-drug interaction program. And so what you do is, if you need to add a new medication or whatever to their chart or up a dose or anything like that, after you're done, there's normally a little button that you can click that will say run drug-to-drug interaction. And what it'll do is it'll spit out these results, and it will say, the this drug and this drug have a mild reaction or a medium reaction or a a risk reaction. If there is a huge drug reaction, then you have to call and talk to their doctor, which is kind of strange to think. As an OTA, you're calling and talking to the doctor about prescription medications that have been given to people. But a lot of doctors, because let me set up the scenario. You might have a primary care doctor who's managing their blood pressure, but then they go and see a heart specialist or an endocrinologist or somebody like that, and they start them on a new medication. And let's say the patient forgot somewhere to tell them all the medications and things that they were on. They might not even know that they were on certain medications or have the capability of doing the drug to drug interaction. So it's important that that stuff doesn't get lost, because the patient might take a new medication and all of a sudden they're completely out of it. The blood pressure is bottoming out. So it's super important that this type of stuff is documented and well taken care of on the OT side of things. Um, we kind of already talked about this, but some things that influence polypharmacy. One, the big one is multiple pharmacies. Now, this has been cut down a lot in recent years. They have a like a drug interface that runs connected from like Walgreens and CVS, Walmart, all the bigger ones. Where like if they're prescribed a certain medication at one place, they're not going to be able to get it from another, or if they're insurance, they can't double charge. I mean, so that kind of helps, but nonetheless, that is starting to become more of a cohesive um, program. Um, all right, so The physiology of these medications and the aging process. So your kidney and liver function declines with age, and that is also going to influence the medications and how that they are being taken up and how much of it is going to be able to be absorbed into the body and stuff. So medications are excreted and metabolized with the kidney, or they're excreted by the kidneys and then they're metabolized by the liver. So your liver is really what is taking in the medication, and then they're excreted through, urination. So anyway, they if there is an accumulation, like your liver function is going down, then you might get a toxicity in the blood that can make the patient very sick. So if their liver is not functioning the way it's supposed to be, some of those medications that like that will build up into their system, and it can cause a bad reaction. So older adults tend to be very sensitive, or more sensitive to certain medications than younger adults will, because their metabolism can't ramp up as fast to deal with dosages. So sometimes you'll see that older adults are given much lower doses of medications than younger adults to make it work pretty much exactly the same. Um, so yeah, they might be more sensitive to things. And then the adage of the start low and go slow is for most primary care physicians now, that's kind of the way they go, is they'd rather start with a lower dose of a medication, see how the older adult is going to react to it first before they up it. So a good example would be like blood pressure medication. That takes a long time, in most cases, for them to regulate, find which one works the best, and all of that stuff, find the regimen and the dosage and everything. So really they just kind of start low with something, see what the outcome is, and then up or move it up or move it down as needed, and go very slow with that process. So, um, OTAs, where are we fitting into this? So OTAs should always note which medications are being used. You should be aware. Now, this is so much more in home health because it's just you and the patient, but across all of our disciplines, medications are going to be listed in their chart, and you should be fairly familiar with the medications that the client is on, so that way you can know if there are possible side effects or drug interactions that are happening while you're doing interventions with a client. Um, Super important stuff. There is a really good table. It is actually on page 181 in your textbook. Now, I'm not going to go through every one of these. This is something that you guys can study on your own time. But this chart, it pretty much breaks it down into all the different types of medications um, that are given for certain diseases. So it breaks down in cardiovascular, blood thinners, pain medications. This is a really good comprehensive list. And then the common side effects are really the things you guys need to focus on for practice, because there might be some of these more common things like blood thinners. There's some really big ones like bleeding and bruising that are very important for you guys to know. Some cardiovascular medications, some common side effects are low blood pressure and dizziness. Like these are really big and really important side effects. They're very common. So it's if you have a patient who just started a new diabetes medication, let's see, and then you get in there and they're feeling dizzy or lightheaded and they're sweating some, and take their blood sugar and it's really low. Maybe this medication that they put them on that they just now tried is way too high, and you need to report that to the doctor. So it's important to know all these. Now, knowing all of these names, that is, I don't expect you guys to do that. And that's, I mean, we're not pharmacists, we're not doctors either, but it is important that you have the ability to say, oh, so I know that these medications for cardiovascular, here's some really common side effects for that, and go like that. So that's how you should study that. But feel free to take your time and pause the lecture if you want to look at that now, or we'll just keep going. Again, go through. These are just more common side effects that are listed in that chart. So take your time, read through those. If you have any questions, reach out to Professor Maciliari, and we'll go from there. Okay. So some strategies that you guys can use to help minimize medication problems. Older adults may be apprehensive to questioning their healthcare providers, because a lot of these, when an older adult has lived in the same place and they've likely had that doctor for a large portion of their life, so they form a very trusting environment. So they might not um, want to question their health care. Like, oh, my doctor said I need to take this medication, but it's very important that you always question, do I really need this medication? Does it have to be this high of a dose? Blah, blah, blah. They should ask lots of questions. What are some common side effects? Not just take something blindly. I mean, that's not good for anybody, regardless of age. Um, some medication regimens often can be simplified if not requested, but if they don't request it, it's not likely to occur. Sometimes that something can be like, okay, you take it in the morning and the evening, and you can simplify some of that sometimes. If they don't talk to their doctor about it, though, it's probably not going to happen. And then if information about medication or side effects is not readily offered, um, an older adult may not even ask. Um, like what the side effects are. Um, in today's day and age, if we're like, hey, I wonder about this blood pressure medication that they gave me, what's some common side effects, and popping into Google. Some older adults may not be comfortable using technology like that, and they're just going to be very trusting of what their healthcare provider said. So it's very important that you try to make them comfortable in asking these questions. Okay. The overuse is another problem. Sometimes clients will forget if they've already taken a dose of a medication, and if they say, "Oh, another one is a little bit as good, so more must be better," that's not true. A client can overdose on stuff really quick, so taking the dose that they were prescribed is very important, as it was prescribed. That leads me to the next part, the non-adherence. If a client doesn't like a certain side effect, maybe they just don't like how it makes them feel or whatever, they might skip doses. But also, if they just don't want to stick to the regimen, or if money is a problem, they might just not take their medications as needed anyway, or take it every other day to save money. Those things aren't okay. The prescriptions need to be taken when they're prescribed and how they're prescribed. Very, very important that that is adhered to, or the medication is not going to be doing what it's designed to do. Um, and then there's medication therapy management services, or MTM services. This is a very much more structured, formal process where the patient works with a pharmacist and their other healthcare providers to optimize drug therapy, like the times that things should be taken and all this other stuff. And it's like forming a cohesive interdisciplinary team. These aren't super, super common, but they do exist. So, if you look at the occupational therapy practice framework, medication routines are under health management and maintenance in the IADL category. So, um, it's an instrumental activity of daily living. So, proper use of medications, though, can be dealt as an ADL. It just depends on which route that you are going at it with in your session. So make sure you're able to break it up in between those two categories. The word participation, when you look at it though, is obtaining medication, opening the containers, interpreting the prescribed schedules, the methods that they're supposed to take it either by mouth or injection or whatever it is, and then filling and refilling in a timely manner and reporting problems or side effects and adverse effects as they happen. So all of that goes into managing your medications, all of which in each area OT fits in. You just have to say which part are you fitting in. Is it obtaining medication that's the issue, or is it filling and refilling in a timely manner? Is it taking it correctly? What part are we involved in OT? Or what part are you involved in with that client? And make sure you document that kind of stuff. So some client factors that play in here are values, beliefs, spirituality, bodily functions, and bodily structures may affect how the medication routine goes. Um, and if something, let's say if something's like given twice a day, technically that means that the medication needs to be about 12-ish hours apart. Sometimes they put that very specifically on labels, but about 12 hours apart from each other. So if somebody wakes up in the morning and they take their medication at 8 a.m., then they should take it again at 8 p.m. unless otherwise the doctor or the pharmacist has told them a different way to do it. So some people aren't going to adhere to certain things because of different schedules, and you're going to need to make that a parent. Like if they say that you need to be able to you do this multiple times a day, but there's somebody that can't adhere to that strict of a schedule, maybe there needs to be a medication change, and that discussion needs to come with their doctor. If they just can't simply adhere to the schedule for the medication that was prescribed to them. Okay. There's a couple theories in your book. There's the self-regulations theory. Um, it goes from it's page 183 in your textbook. Um, it goes on, but these types of theories and things, like the self-regulations theories, these are just their personal values, beliefs, and things that like contextual stuff for clients. I'm not super worried about you guys knowing the exact theories. If this is something that you want to get really more involved into, I just want you guys to really know the basics about where OT fits in and some common interventions for medication management. So I'm going to go through some of this stuff. Um, and you feel free to dig into it a little bit more. But bodily functions also are going to be a big part of medication management. So their mental functioning, their sensory functions, there's so many different things that can affect. Each thing listed here on the slide can affect how somebody's able to adhere to a medication management routine. For example, mental functions are going to be able to remember to take it when they're supposed to take it. Metabolic and digestive, is their body able to take the medication and absorb it the way it's supposed to? For sensory and pain, do they have feeling in their fingers to be able to open up the pain or the pill bottles? So on and so forth. There's just all kinds of different routes, and you're going to have to make this very personalized, because each person, there's very few things that are going to be more personalized in OT than helping somebody come up with a medication routine, and helping them adhere to it, and they may be able to be independent in it, because it's just so personal to them. Some people are going to have injections, some people won't. Some people take pills by mouth. Some don't. Some people are even going to take pill or their medication through a feeding tube. Like there's so many different options. So you're going to have to make the effort to make each person feel in their intervention sessions that what the interventions you're giving them are personalized. There's going to be some that are general and helpful that are common that help a lot of different things, but there's going to be a lot you come across that are just not going to work for everybody. Okay. I'm gonna go through these bodily functions. I'm going to talk a little bit more about that with these interventions. That's why I'm kind of skipping through this. But you guys already know what activity demands are from OTA to O2, but it's all the different aspects of an activity. So everything from the objects and everything about that object, the space, social demands, timing, and sequencing, like every little aspect that you break down in an activity analysis of the activity demand. So you have to really do that with medication management. If you need a review on that stuff, feel free to go back to your 202 textbook. But I wanted to break this down a little bit more just so you can see all of the realms that OT is involved in with medication management. So for objects and their properties, some common things you're going to see in this is pill boxes, pill bottles, syringes, inhalers, tubes, gloves. That's the normal like supplies you need. For space demands, space to complete it is going to be different depending on where you are. Appropriate lighting is going to be an important generalization. Um, Ample room, medication storage. A lot of people don't even think about that. Like, where are you going to store your medications? Um, because a lot of older adults, you look in their medicine cabinet, it looks like an explosion. Um, so the social demands. Um, does their medication routine require them to communicate when one medication needs a refill? Do they have to call and get their doctor? Is it an automatic thing? See, some primary care doctors are very just very strict with that they have to come in for them to get a refill past their 90 days. And some doctors are very like, they've been on it for 3 years. Why would I change it now? It just depends on their physician. So sequencing and timing is also a big part of it. Are they, when are they going to take it? How often? what time of day, all that good stuff. The required actions and performance skills are being able to open and close containers, manipulate the object, hold on to the pills. Can't tell you how often it is that patients will drop their pills on the floor and can't find them and all that kind of stuff. The last thing you need is the little dog to eat their blood pressure medicine and the dog pass out on the kitchen floor. So they need to be independent and being able to hold their pills. Required bodily functions, again, the mental aspect of it, neuromuscular, speech functions, all of that, and the required bodily structures, using their hands, their eyes, all that good stuff. It's pretty crazy to think about how many aspects go into just being able to take your medications. And this is one of the harder things to get patients to adhere to because it is an inconvenience. I mean, even for myself, I take one allergy pill a day, and it's so hard for me to remember that. I cannot imagine when I get older and I'm probably on a whole Skittle pack of pills every day, how hard it's going to be able to stick to medication management routine and not forget to do something because like halfway through your day you're like crap, I'm not even home and I have to take this medication. I forgot it at home. Do I just not take it, or do I go home and get it and then come back? Or I mean, it's an inconvenience and it's hard to keep track of. Okay. Table 13.3, that table we just went over, that is on page 186 in your textbook. So feel free to go through that and break down each area if you need to. Okay. Um, sorry, I'm skipping through some of this. I'm sure by this point you guys know what the occupational therapy process is. So I'm going to skip over that and talk a little bit more about the interventions of it. So here's some really helpful things to help adhere to medication management routines. So one of them, very common, is a calendar. Very simple. Either on, if you can do it on their phone if they are tech savvy. If not, a little pocket calendar or a big calendar if they need something bigger that's hung on the wall. They can say what time each day they're supposed to take their medication or write down their when they need to contact their doctor to get a prescription refill. Um, so many different things that you can help with the organization with just a simple calendar. Um, I know everybody has seen what a pillbox looks like, but there's tons of different types of them. We've had some students that have adapted pillboxes to make them easier to open because they can be kind of hard with fine motor skills or arthritic hands and stuff like that. Insulin pens. This makes it very easy. You know, my grandmother doesn't, she's on insulin and she still takes it the old fashioned way with just a needle, syringe, pulls it out and all this other stuff. But a lot of insulin pens have now moved to, it's just a little twist and turn system. You turn it to how much medication you want, stick it on the skin, hit the button, and good to go. Move on to the next thing. Those are very easy to use for a lot of patients, considering that the old system is a little vial. Stick the needle in, pull it out, make sure it's just right, and give yourself a shot. You don't have to do that now. These pens make it much easier. Okay. Pill splitters, another really common one. You put the little pill in, it has these two little razor blades, you push it down. Now, and it will tell you on the medication's bottle if it can or can't be, but some cannot be. Um, you cannot use it to cut some pills. Some pills are not allowed to be cut, like capsules can never be cut. You should never use just a straight razor blade to cut a tablet. I've seen patients try to do that. It's dumb. Pill cutters are always the best way because it's very precise. And a lot of times the medications will have a line down the middle. If it's a half dose type thing, they can cut it and keep it in the pill bottle that way. Another one is a pill crusher. Um, Not all tablets can be crushed, but some can. What they do is they stick it in these little baggies, and it's this thing, and it's got this big lever, and you just push down on it, um, and it turns it into a powder. Oftentimes, they can't do this with all things, but they will take that powder and mix it in like applesauce or something, make them eat the applesauce. If they're Especially if they have a hard time swallowing pills, that's a really good thing. These are very common in skilled nursing facilities that they will give patients their pills that way too. But again, you gotta read the bottle because it'll tell you if it cannot be crushed or cut because that is very important. So here's some of my favorite ones. And I've used these multiple times with clients and I've always had good outcomes. My favorite one is a talking alarm. They're about $40 that is on Amazon, but I would get it for clients who had a hard time remembering when to take their medications. So it would, there's a little medication alarm that they would have them sit in their kitchen wherever they put their pills. And it would say, hey, and then let's say Tanya, hey, Tanya, your morning medications due, and it would just keep saying it louder and louder and louder until they took their medication and hit the button. It was a great invention. I absolutely love it. So a medication tracker app, again, if they're tech savvy, you can get those reminders and things on their phone. There's a shaking alarm. This is if if a client is sleeping, it will kind of shake that it's time for them to take their medication. Now, I've not used this one simply because I think that if they don't have any hearing impairments, that a talking alarm is a little bit better. I personally would rather be like have an alarm go off instead of having my bed shake or um, it's I'm not a big fan of it's not the whole bed that shakes either. It's like a little device that goes on the bed and it kind of shakes, but I'm not a big fan of that. I think anyway, I won't get on that soapbox. All right, so and then a talking prescription bottle. These are really wild. It's like a little screw on that goes on the top of the bottle, and it is beneficial because it is for patients who have low vision or hearing impairments. Um, you can turn it up and it can get actually pretty quite loud, but it will talk and say, "Time for your morning meds. Time for morning meds." But it's very similar to the talking alarm, but it goes on top of a prescription bottle. And you guys can look these all up on Amazon. Every one of these are available. I mean, all over the place. Some homemade things is a medication diary. So especially starting a new medication, I will have a client say, okay, write this down on your diary because I have them write down how they feel and take their vitals and everything every day anyway, especially I'm speaking from a home health perspective, but um, I will have them write down, okay, I took lisinopril, a new medication, and then if they had any side effects, make sure you write those down and make sure they're recording their vitals and make sure when they took their medication so that way they don't forget that they've already taken it and accidentally take a second dose or think that they took it and they didn't. Just make it part of their routine, writing it down almost like a checklist. The storage cups, these are pretty common. You've probably seen them come in in hospital rooms or in facilities. They come in and sit this little cup down on there and say, all right, take it. They're supposed to stand right there and wait till they see them actually take the pills and then mark it down. But you can actually use this at home too. They don't have to be in facilities. You might even say, if especially if they're like a caregiver for somebody, all right, set up a morning, afternoon, and evening pills as they need, and just write morning, afternoon, and evening, and they go in, take the thing, take a drink of water, move on. Like it's very quick. But it does very similar to what a pillbox will do, but pillboxes need a little bit more fine motor coordination to do than just like a cup that you can take the pills almost just like a drink. You just put it in, take a drink, and they're gone. A self-medication program. Um, so what these are, they're designed to use an interdisciplinary team approach. Um, it's to use these are programs where you might have a doctor, pharmacist, therapist, whoever involved in this team, and they're educating the older adults about what medications they're on, common side effects, all this stuff, because sometimes they're prescribed something and they're not given all of the information. Um, but it's to properly help them be able to do every aspect of the medication routine from opening pill bottles, knowing their side effects, maintaining a diary, maintaining the time of day, and all this stuff that goes along with it. So it can be very useful. I have not personally been able to find one locally to get a patient in there. I know of some, but I never had any patients that were in that primary care setting, so I never got it. But they do exist. You can also have some relatives and friends there to help and get them involved in the discussions. So that way they know, like, hey, if you see the side effect, there might be something going on with the medications. We need to know about it. But families and caregivers should be able to do a couple things. They should be able to name the older adults' medications, describe why they have that medication, and describe any precautions that go along with it. One of the biggest reasons is for emergency situations. They should always have a list of medications readily available for EMS workers or hospital staff. So they say, what medications are they on? What do they take? You should know immediately what that is, either by handing them a list that is kept on their refrigerator for a lot of people. Um, that needs to be something that's prioritized because that's one of the first things. What medications are they on? Do you know? Okay, here it is and gone. Okay. So that's kind of the overview of medications that are going through. And on your PowerPoint too, you guys can go through these chapter review questions. Feel free. But that's just kind of the overview of the medications and all the different aspects of it. There's other cool interventions that are listed in your textbook. So, feel free to look through those. And don't forget that you guys do have a case study in this chapter, a guy named Roman. So, if you guys have any questions, reach out. But that is it for now.